Bacitracin ointment is used to prevent minor skin infections caused by small cuts, scrapes, or burns. Bacitracin works by stopping the growth of certain bacteria. It belongs to a class of drugs known as antibiotics. This antibiotic only prevents bacterial infections. It will not work for virus or fungus infections. Unnecessary use or overuse of any antibiotic can lead to its decreased effectiveness. Indications. Bacitracin is a topical antibiotic ointment widely used by both medical professionals and the general public to treat minor skin injuries, including cuts, scrapes, and burns. How to use. Use exactly as directed on the label or as prescribed by a doctor. Don't use in larger or small amounts or for longer than recommended. Clean the skin area before applying bacitracin topical. You may apply bacitracin to the affected area 1 to 3 times per day. Apply only enough to cover the area you are treating. Don't use this medication over large areas of skin. You may cover the treated skin with a bandage. Don't use bacitracin for longer than 7 days in a row. Call a doctor if your symptoms do not improve after 7 days of treatment or if you develop a skin rash. Contraindications. You should not use bacitracin topical if you are allergic to bacitracin, mineral oil, or petroleum jelly. Don't use bacitracin topical to treat animal bites, puncture wounds, deep skin wounds, or severe burns. Ask a doctor or pharmacist if it is safe for you to use this medicine if you are not sure. Bacitracin is not expected to harm an unborn baby. It is not known whether bacitracin passes into breast milk or if it could harm a nursing baby. Ask a doctor or pharmacist if it is safe for you to use this medicine if you are pregnant or breastfeeding. Precautions. Bacitracin topical is for use only on the skin. Avoid getting this medication in the eyes, nose, mouth, rectum, or vagina. If this does happen, rinse with water. Don't use on large areas, serious burns, deep puncture wounds, animal bites, or eyes. Discontinue if condition persists or worsens. Reevaluate after 1 week. Before using bacitracin, tell a doctor or pharmacist if you are allergic to it, or to neomycin, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Side effects. This medication usually has no side effects. If you have any unusual effects, contact a doctor or pharmacist promptly. Rarely, use of this medication for prolonged or repeated periods may result in other types of skin infections, such as fungal or other bacterial infections. Contact a doctor if you notice any unusual skin symptoms or if your condition does not improve. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing,